students, so moving along with this week's lectures. So we just finished with the endocrine system. Now we're going to go into the respiratory system. The respiratory system is actually pretty simple, but lung problems are is the major reason for suffering and stuff in America. Lung damage and damage to your lungs can actually cause heart problems too. So I want you to start thinking about this. Lungs and heart go together. That's why we have CPR, cardiopulmonary resuscitation. Pulmonary is lungs. So let's jump right into the respiratory system because it is actually a very simple, straightforward system. So, of course, you breathe in. You suck air in your nose, and as it goes through, that goes to our nasal cavity. Then it goes to our paranasal sinuses. Sinuses are just air spaces, okay? Then it goes into our nasal pharynx, goes from our nasal pharynx down to our larynx, into our trachea, bronchi, bronchioles, alveoli, and alveoli is where we have the oxygen exchange that happens. Very simple. So it's divided up into upper respiratory and lower respiratory. Easiest way to understand this is an upper respiratory infection is going to be a sore throat, common cold up in your nose, tonsils. It's a sinus infection. Okay, that's your upper respiratory. Lower respiratory is going to be in your lungs. Okay, so in your lungs is going to be you get hoarseness in your voice, which means that our vocal cords, they can get an infection or something like that, so we wind up having, well, you can't talk. Oh wow, brain cramp, forgot what that is, laryngitis, okay? And all the way down into our lungs, so we get the pneumonias. Guess where COVID goes? All the way down here into our lungs. All right, the divider between upper and lower respiratory. So it's going to be right in here where we have the epiglottis that flips down. So right here what becomes the larynx. Now, think about this. We suck air in here, and we have these turbinates right here, these concha. And what they do is they spin things around. The air spins around, so it hits as much mucous membrane and hair and gets cleaned up, warmed up, and moistened as much as possible. Then when the air gets back here, now we're in the nasal pharynx. As it goes down here, it goes to where our mouth is. So now we have the oral pharynx. It's the oral pharynx. And what that does is it comes down here to the, as it goes down to the pharynx, just the regular pharynx. Let me see, and then it goes going to go where? Flip down in here, and it goes to your trachea. Right? From your trachea, it goes down your trachea, and it goes into your bronchi, the primary bronchi, and it starts to divide up and separate out until it goes into your bronchioles, and it goes to your alveoli, and smaller and smaller to your alveoli sacs. Function. All that we're going to talk about now is what we want to do is get air into our lungs so that we can get oxygen into our blood, and then when we exhale, we're going to blow out CO2. Now, blowing out CO2 is going to get rid of, now CO2 travels in our blood in a molecule called carbonic acid. So it is an acidic pH. But if we blow out the CO2, what we're now doing is we are taking the carbonic acid and removing the CO2 from it, and we are turning it back into basically water. Okay? So just understand it like that. It is the breathing out that actually gets rid of CO2, which makes our pH more basic. So it gets rid of the acid in our blood. Okay. Respiratory epithelium. Let's go right into a picture, okay? You remember this. So we have our cilia. Remember, it's pseudostratified. It kind of looks like there's more than one row, but there's only one row. So it is pseudostratified, ciliated, columnar, really long epithelial tissue with goblet cells. The goblet cells make mucus. All right? Pretty simple right there. And then we have, of course, the mucus glands underneath. A lot of mucus. And we're familiar with that because every time, like if you have an infection, you cough up, all that mucus comes out. Respiratory defense. How do we keep, because the outside air is got some problems in there. So we don't want to get those problems into our lungs. So our defense in our respiratory system, we start off with our epithelium. Hairs in the nose. What that does is it blocks a lot of stuff. It's a filter. Okay? Then we're going to have mucus in our nose. Inhale to breathe. The mucus. When you sneeze, you blow that out. All of us have actually sneezed at some point and been like, wipe that down before anybody sees. Okay. So the mucus helps to trap things. Coughing removes stuff. And the mucociliary escalator. What that means is the cilia pushes the air up, the debris upwards, and you'll cough it out. We swallow most of our debris. Okay, so it enters the nares or nostrils. Vestibule just means an opening into our nasal cavity. Nasal septum, right and left side. We're familiar with that stuff. Okay. Now, the conchas right here, they swirl the air around. Concha always reminds me of jets up in the atmosphere. They leave a conch trail. The conch trail is because the air was spinned around so much that you actually see that smoke. So the concha, it to me always means spins the air. Okay. Now, so remember, we start with the nasal pharynx, go to the oral pharynx, and then we go down in here, we're going to the larynx. So we have the laryngeal pharynx that's underneath. Okay. We don't need to go into too much detail on here. Just know in your mouth, we have the hard palate, which separates your nose from your mouth. The soft palate right here, that's going to be what separates the nose from the mouth in the back. Hard palate is bone, soft palate is cartilage. I don't want to go into too much detail on that. We're actually moving along pretty good here. So nasal pharynx is nose, oral pharynx is mouth, laryngeal pharynx is when the nose and the mouth come together before it goes into the larynx. So this area right in here. Yeah, there it is in a cadaver. Kind of gross. Why don't you look at the trachea though? Little tube right here. And right behind the trachea, that is our esophagus. It's this nice flat muscular thing. Now, what's cool about the trachea is it has these U-shaped cartilage. Behind the U-shaped cartilage is going to be the flat esophagus. The esophagus lays in here, and it's all flat. Now, what's cool about it being this U-shape is by having this U, it makes it so that we have a U here, and in here is this flat tube. The cartilage is going to keep your trachea open. When you swallow, your esophagus can expand. It can push into that U, so we can have that big glob of food that goes down into our stomach. It's an amazing piece of engineering. Okay, now your larynx is now where we start the lower esophageal. The lower respiratory system. Easy way to remember that is the pharynx is above the larynx. The pharaohs in Egypt, the ancient pharaohs, they liked cats. One of the cats was a lynx. So the pharaohs have a pet lynx below them. All right, so the pharynx goes to the larynx. In the larynx, we have the thyroid cartilage, cricoid cartilage, and the epiglottis. We'll talk about these guys in a second. So the thyroid cartilage, Adam's apple. Okay, voice box. Cricoid cartilage, right underneath that one. Trachea, tracheal cartilage, those are the U's. Okay, all right, now I have blue here. Go back to red. That's the U-shaped cartilage. Okay, in the back here, the epiglottis, what the epiglottis does is it's actually a flap. And so the epiglottis here, being a flap like this, what it does is it flips down and it makes it so that food is going to go into the esophagus and not down your windpipe, which is your trachea now. Parts of the epiglottis and the larynx, I don't really care about that. I don't want to go into too much detail on here. But in your larynx is where we're going to have our vocal cords. So what happens now is we have our vestibular fold, which is just the area that is going to open and close. It's not the functional portion of our vocal cords. The functional portion of our vocal cords is going to be these guys right here. Okay? They open up, you see the glottis area. Okay. So, the vocal folds are going to be the little lines right here. These are the things that vibrate. These are your vocal cords. So this is your vocal cord. Okay. This picture is better here because it actually shows when it opens up. This is your epiglottis. It's the flap that will go down and cover this stuff to make sure food doesn't go down your windpipe. The reason why you can't talk while you're eating, even though a lot of people seem to try. So here we go. You chew your food, swallow your food. So it's a bolus. It goes down to your oral pharynx, goes down to your laryngeal pharynx, and right here you can see this is your epiglottis. Your epiglottis now flips down, and it covers your trachea and makes sure that the food goes into your esophagus. Let's see, pretty simple there. Now, once we get past your larynx, now we're in our trachea. The trachea now is going to go down and it's going to split. It's going to go into your left and your right. So your primary bronchi, where now it's entering into your lungs. Let's see. In the trachea, we got the mucus membrane. What I like about here, it's a great picture. This is your trachea. Remember, that stays open because we have this cartilage right in here. This is your esophagus. Okay, this is all muscle. That opens up and pushes food down. When there's no food, it's just really flat. Okay, now your trachea branches at it's called the carina. Now when it branches, it goes to your left and right main bronchi. Now they're going to enter into the lungs. So this right here is the carina. Okay, now where the bronchi go into the lungs is referred to as the hilum. So the hilum is at the one of this portion right here. That is where it comes in. Where we're going to have the bronchi are going to go in. It's going to have a lot of pulmonary veins, pulmonary arteries. We'll go into that when we go into more detail. All right. When we go into the cardiovascular system, we'll talk about that more. Okay. Right lung, 3 lobes. Left lung, 2 lobes. Left side, more heart. That's why 2 lobes. Got to have space for the heart. Remember, this is our chest. Our lobes are divided. So, this is your right lung. Right lung. So now we're going to have what? 3 lobes. Superior lobe. Middle lobe. Inferior lobe. On the left side, because of the heart, we're just going to have our superior lobe and our inferior lobe. It's divided up into lobes because by having these things sectioned off, if we get pneumonia or an infection, we can keep it isolated into this one and it won't affect the others. End of story. We'll go into more detail with that in class. Costal surfaces against the ribs, mediastinal surfaces in the middle here. You see the connective tissue is going to be a trapecular pattern. Let's not go into details on that too crazy. I don't want to kill you on all these little details that aren't going to make a difference. Okay, lobar bronchi means it went into an actual lobe. Still a big one. Bronchi are larger. This you're going to see a few times. Main bronchus, large. Bronchus is 1, bronchi is 2. So now I go up here to the super. You see how it's going down? And the farther we go into the lungs, the smaller and smaller. So now the bronchus, what they're doing are they're actually breaking down and then they eventually become bronchioles. Very tiny. Bronchioles keep breaking down until they actually get into an area where they're going to go into the alveoli. Go alveoli ducts become alveoli sacs. Okay, let's see. Right main bronchus, superior middle. Okay, makes sense because the right lung has superior lobe, middle lobe, inferior lobe. Hey, guess what? On the left side, we just have a superior and inferior. Okay, left side, superior, inferior. Remember, these are the bronchus that are going to those lobes in that section of the lung. Get to the picture that actually shows it better. Okay, so bronchopulmonary sections, superior lobe. This right here is going to be all of the bronchi. Kind of sets it up. Just understand that everything is divided in our lungs. So we get an infection on one side, it's not going to disseminate and go through the whole lung. We want to try to survive. I had a patient who had a lobe actually removed. She actually had her right upper lobe removed because she got a fungal infection. So they're fine. But it was isolated to that one area because of the way the lungs are set off. Bronchioles are just where we have our bronchi get smaller and smaller and they become bronchioles. See, bronchioles end in alveolar ducts end in alveolar sacs. Each lung has about 150 million alveoli. These alveoli are where we're going to have gas exchange happens. If you were to open up the space in your lungs, including the airways and the alveoli, and lay it all out, it would cover 1/3 of a tennis court. That is how much area there is in our lungs. Here is our alveolar sac, and we have our individual alveoli inside. As you can see, artery, vein, big capillary bed, gas exchange. In the alveoli, we're going to have type 1 cells and type 2 cells. Okay, type 1, the main purpose of the lung is going to be for gas exchange. So type 1 alveolar cells are going to be for the gas exchange. That's the most important. Now the alveoli is so narrow, so small, that we need to make sure that it doesn't collapse on itself. It collapses on itself. It's called alveolectasis. And that's why when somebody has an infection and they inhale, it sounds like, if you put a stethoscope on, it sounds like you just put milk into your Rice Krispies. You'll hear this like popping sound. And that is because as the lungs expand, the liquid, the fluid, is opening up and the small airways are opening. That is referred to as fine rails. What makes that liquid is your type 2 cells. So your type 2 cells are going to make surfactant. That is the fluid. It's a soapy type fluid that keeps the alveoli from collapsing. Now we're bringing in air from the outside, so we have some pathogens in there. So in other words, we've got to keep ourselves safe from all the bacteria, viruses, and things that get into our lungs. So we're going to have special alveolar macrophages. Macrophages are white blood cells that travel around and they see something bad, they engulf it and they destroy it. So that is our immune system right there. And you see here, we're going to have the macrophage that's cruising around. Our type 1 alveolar cells, what they do is they are really thin and they just allow for oxygen and CO2 to move back and forth. And our type 2, what they're doing is they're making the surfactant, which keeps our alveoli open. What I like is you can see the alveoli sac in here. So this is a bronchiole, really small. Look how small the alveoli sacs are. And all this little lines right here is a combination of elastic tissue and our actual alveoli, for which the alveoli is going to be simple squamous epithelial tissue, really small cells squished together. Type 1 and type 2 alveoli cells. Okay, let's see. I'm going to detail a little later on. Now remember, our lungs are actually inside of our chest cavity. So every time we increase the size of our chest cavity, what we're doing is we are increasing the space, the pleural space. As we pull that, we create suction and we pull the pleura, which is our lungs, with our chest cavity. So that is what actually increases the size of our chest cavity and therefore increases the space inside our lungs, creates negative pressure, and we pull air in. Pleurisy is just where we get fluid that builds up in between our visceral and our parietal space. We get fluid that builds up in there. It can be a cause, our liver can cause that to happen, or we can have an injury. And in order to take care of that, we have to do a thoracocentesis, where we're actually going to stick a tube in there. We're going to drain you out like tapping a keg. So, how do we do this ventilation? Primary muscle of respiration is our diaphragm to help us breathe in. We have external intercostal muscles which help us expand our chest so we can blow air out. Okay. Accessory means not the primary. Serratus anterior, our scalenes. Pec minor lifts everything up, and our SCS. Everything lifts our chest cavity. Let's see. To blow out, it's going to mainly be our abdominals and our internal intercostals, which help us bring our chest down and put more pressure in our thoracic cavity. So, respiratory. Don't worry about this too much. The main one I want you to be aware of is the diaphragm. Diaphragm actually balloons up into your chest cavity, and when it contracts, it pulls down, it flattens out. So when it flattens out, it increases the space, creates a sucking factor. That's not really all that important. When it comes to birth problems, I want you to be aware that your lungs are never used until the first time you come out. So as soon as you come out of the womb, the doctor's going to want to make sure that you cry. If you cry, what happens now is it means that we now have oxygen going into your lungs, which is why you give birth, you come out, some stranger grabs you, and if you're not going to be crying, he smacks you on the butt and tries to make you cry. Welcome to the world. It's a rough place. Oh yeah, then they judge you, they count your fingers and toes, they weigh you, they measure you, and they give you a grade. So now you've been kicked out of a safe place, your mom's womb, you've been beaten by a stranger, and you have been judged. Okay. Respiratory centers, let's keep this real simple. The medulla oblongata handles heart rate and primary respiratory, just for relaxed breathing. And then it goes up to the pons, and in the pons it is reacted on by if we are exercising, so to speak. So that's going to be our nervous system and our adrenals and things like that. Another key to understand here is the main thing that regulates our respiration is our need to get rid of CO2 to control the blood acidity, the acidity in our blood. That's probably good enough.